The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Skincare trends, they come and they go, often because they aren't backed by science. However, red light therapy, also called photobiomodulation or low-level light therapy, may be a product that is here to stay. I don't know about you, but I frequently see ads on social media for red light therapy masks. And recently, one of the women enrolled in my course, The Perimenopause Answer, has asked me what red light therapy is since her local spa has started offering this treatment option. This non-invasive treatment uses near-infrared light to affect the body's cells. While red light therapy may have begun as a treatment for aging skin, experts are finding that low-level red light may also have other health benefits. So, here's what you need to know. What is red light therapy? Photobiomodulation uses near-infrared light emitted by LED lights or low-energy lasers. The red light energy produces a series of biological responses at a cellular level. Most red light therapy, especially home devices, use LEDs that emit light on low-level wavelengths that make it appear red. It can also be administered using low-energy lasers or a combination of LEDs and lasers. Lasers are more likely to be used in professional settings than at home since they provide deeper penetration of the tissues. Red light therapy is available through many types of devices, including beds, which look like a tanning bed and expose the entire body, caps or helmets for your head, masks that fit over your face, that's predominantly what I see advertised, panels that can be mounted on a wall or placed on a table, wands, handheld devices that you wave over the area of the body you want to treat, pads that fit over joints, neck, back, or feet. They even have underwear pads to help with bladder or prostate symptoms, for example. Unbelievable. The type of red light device and how often you should use it depends on where the therapy takes place and what area of the body you're treating. How can red light therapy benefit your health? Well, photobiomodulation is not a one-time treatment. You'll need to use it consistently to see best results. Researchers are still trying to determine how long and how often to use red light therapy for optimal results. They also don't know the long-term effects at this point. Experts know that in the short term, photobiomodulation seems to have significant health benefits with few adverse effects. So, how can we use this red light therapy? Well, we can use it to reduce the signs of aging. The Food and Drug Administration, FDA, has cleared several red light devices for home use in treating aging skin. Dermatologists offer red light therapy often combined with creams, microneedling, or chemical peels if you want to do the treatment in a dermatology office. Red light therapy can treat dark spots, discoloration, fine lines and wrinkles, loose skin, and acne. In a 2023 study, researchers measured the effectiveness of a red light therapy mask using red LEDs on the facial skin. Treatment included 2 12-minute sessions per week for 3 months. That's 2 12-minute sessions per week for 3 months. The LED mask used in the study was the Skin Light Dior, as in Christian Dior, the Skin Light Dior times Lucibel mask. That's the brand name. Skin Light Dior times Lucibel mask, diffusing a cold red light. It is currently one of the most powerful LED products on the market. This little item can be purchased on the Dior website to the tune of $4,300 US. The qualities they checked before and after the treatments included crow's feet wrinkle depth, smoothness of skin, size of pores, as well as firmness and elasticity of the skin. They found an improvement in skin quality in all of these areas and reversal of visible signs of aging. Additionally, the results lasted for up to a month after stopping therapy. The FDA has also cleared several at-home red light devices, including combs, caps, and helmets for hair regrowth. These are usually low-level laser therapy devices versus LED red light therapy that I just talked about for use in facial masks. There are some devices available for hair regrowth that use a combination of low-level laser therapy and LED red light. A 2021 review of 9 studies was completed to evaluate the effectiveness of red light therapy for hair regrowth. 5 of those studies used a comb device, brand name Hair Max Laser Comb, that's Hair Max Laser Comb, and 4 of the studies used either Top Hat 655 or iGrow 655 helmets. That's Top Hat 655 or iGrow 655 helmets. The treatments usually lasted 15 to 20 minutes, 3 times a week for 6 months. There was a focus on hereditary and hormonal hair loss. The results showed that repeated red light treatments not only helped regrow hair over time, but also increased hair thickness and length. Sounds good, eh? One study suggests that low-level laser therapy may be as effective as minoxidil, which is the medicine in over-the-counter Rogaine. Minoxidil is a medication commonly used to treat male pattern hair loss. I will discuss additional benefits of red light therapy, yes, there are more, after this quick break, so stay with me. I am glad that you're back. You can also use red light therapy to minimize acne. There is a thing called photodynamic light therapy, and this therapy is not a new treatment for acne. It uses blue light to destroy acne-causing bacteria and oil-producing glands. Red light therapy works very differently from blue light. Red light is absorbed by the tissues and produces energy within the cell. This process is called photobiomodulation, a term that I mentioned earlier. The action of light stimulates the synthesis of growth factors and reduces oxidative stress, which results in anti-inflammatory and antibacterial effects. The process promotes healing and reduces inflammation without destroying the cell, which is what blue light therapy does. A small study of people with mild to severe acne found that a series of 6 treatments performed every 2 weeks resulted in significant decrease in the secretion of skin oil, significant improvements in acne lesions, and no adverse effects. Even better results can be achieved by using a combination of photodynamic, which is that blue light, and red light therapy. A large study found that people who used both red and blue light treatments were more likely to have a complete resolution of their acne. We can also use red light therapy to ease chronic pain and inflammation. In a 2023 study, 11 articles were selected that dealt with different types of chronic pain and analyzed how well photobiomodulation using red light therapy works to reduce chronic and acute pain. In the articles reviewed, not only were reductions in inflammation markers observed, significant improvements were reported in pain associated with fibromyalgia, knee osteoarthritis, nonspecific low back pain, and surgery. However, in many instances, the chronic pain returned within weeks of ending therapy. So, therapy needs to be continued to provide continued pain relief. The devices come in pads that can be wrapped around the knee, the neck, or the back. There are also full body pads, boots, wands, and pulse devices. Devices that use low-level laser therapy versus LED red light therapy is a better option because laser therapy reaches deeper into soft tissues, joints, and muscle. I knew that red light therapy could help skin, hair, muscles, and joints, but honestly, I was not aware that there are studies that show that headsets and helmets can transmit near-infrared light through the skull and nostrils, exposing the brain to red light therapy. There is ongoing research showing how this treatment affects cognition in people with dementia. Totally did not know this. In 2021, a review of 36 studies was completed, and all studies reported positive results. They showed significant improvements in cognitive function after treatment with red light therapy through the nose and skull. More recently, a 2021 study included patients aged 50 to 85 years old who had been diagnosed with early to mid-stage dementia, who had dementia-related symptoms and were generally healthy. These folks were exposed to LED red light therapy for 6 minutes daily for 8 weeks. 6 minutes daily for 8 weeks. At the end of the treatment, researchers saw positive cognitive improvements without significant adverse effects in people with both mild to moderate dementia. Amazing. So, what is this kind of therapy going to cost you? The cost of home-use red light therapy devices can range from under $100 for a small portable red light therapy unit to over $5,000 for professional light therapy beds. Here are the key factors that influence pricing. The type of device matters. Small devices obviously are more affordable, ranging from $50 to $500. Mid-range panels and masks can cost you $500 to $2,500, while full-body pain relief panels will run you about $2,500 to $5,000. Technology used also influences the price. LED therapy and laser light therapies differ in effectiveness and cost. Laser light therapy provides deeper tissue penetration than LED light, so that is usually reflected in the price. Portability and design is also a factor. Portable light therapy options are typically lower in price than a fixed panel or a panel with a stand. Brand and quality, of course, makes a difference. Quality devices often use medical-grade materials and have FDA clearance, which I'll talk about in a minute. There are some tips for safely using red light therapy. No research has suggested that red light can cause cancer, unlike our ultraviolet light. Devices labeled FDA cleared pose a low risk to the public. However, as I mentioned before, we have limited research to understand the long-term effects of photobiomodulation. The American Academy of Dermatology Association recommends taking the following steps before using red light therapy at home. Talk to your dermatologist or your primary care provider. It is always a good idea to consult your provider before starting any new therapy. People with darker skin tones should be especially cautious. Their skin may be more sensitive to red light, which could lead to dark spots on the skin. Use a device intended for what you want to treat. Certain red light devices are more effective for specific areas of the body. As I mentioned earlier, there are even underwear red light therapy pads. Very, very specific. Look for devices labeled FDA cleared and follow the directions that are given on each device. It should explain how long to use the light and how to protect your eyes if you are using red light therapy near your face. Many of these red light devices are actually FSA or HSA eligible for problems like acne or hair loss. Typically, they are not eligible if you use them for cosmetic purposes. When searching for a device, make sure you search for FDA cleared devices. If the device says FDA approved or FDA certified, that means nothing when it comes to red light devices. The FDA evaluates the safety, not the effectiveness of these devices. So you are looking for devices that have been FDA cleared. That's the verbiage you want to look for. And if you want to use your FSA or HSA account, include that criteria in your search. To tell if a red light therapy device is real, check for specified wavelengths, which should be either 630 to 660 or 810 to 850, and the power density should have a measurement of 20 to 100. Real devices will also usually provide scientific studies for their claims, like the ones I just discussed with you. As an example, the brand Omnilux, 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 which is not an Itchy and Bitchy sponsor, clearly state on their website that their products are FDA cleared, made of medical grade materials, and the science behind the products is provided. So if you want an example of how that should be stated on a website, you can visit the Omnilux website. I don't know about you, but a red light therapy device may be on my Christmas wish list. As a matter of fact, at the time of this late November airing, you might find a good deal during Black Friday sales. I thank all of you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Again, I tell you that reviews and ratings really actually do matter. Also, make sure you follow the show so that it will be automatically downloaded. That matters too. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. Thank you to Forrest Wenzel, my son, our producer and composer of our theme music, and the person who I've told you before does all the behind-the-scenes work to make this podcast possible. Thanks, Forrest. Forrest continues to thrive at Peabody Music Conservatory. If you want to listen to what he is creating, you can go to his website, forrestwenzel.com, FORRESTWENTZEL.com. Your health is in your hands.